Well, we start to talk about the introduction of the cancer. In the organisms, the cells of the body grow, divide, and die in an ordinary fashion. In the first years of a person's life, their normal cells divide more rapidly until adulthood is reached. Sequentially, normal cells in the more tissue divide only to replace worn-out cells or to repair injuries. The normal cells become a tumor cell due to a change or mutation in its DNA. There are cells that lose the ability to perform the functions that correspond to the tissue from which they come. Also, they are often immature because they multiply so quickly that they don't have enough time to fully grow before dividing. By skipping from cells growth in the body, they are not limited to the original space where they are formed and are capable of spreading to other areas, which gives them the characteristic of invasiveness. Also, they tend to migrate to other places through the blood or the lymph. This is how, if they manage to escape the controls of self-growth again, they can start to proliferate in a different place that is metastasized and damage other organs. Cancer is the leading cause of death worldwide. In 2015, 8.8 million deaths were attributed to this disease. The most common deaths are pulmonary, hepatic, colorectal, gastric, and mammary. Then we talk about the cancer etiology. The man, as a biopsychosocial being, maintains a close relationship with the environment that surrounds him, and this influences his health in various ways. Carcinogens are the agents that increase the factor of exogenous, social, and environmental causes. The first cause is incidence factors. We have here the chemicals and other substances. Exposure to substances such as certain chemicals, metals, or pesticides can increase the risk of cancer. Also, we have the tobacco. The tobacco is the most common carcinogens in our society, are those present in cigarette smoke. Tobacco smoke is known to contain at least 60 carcinogens and 6 developmental toxicants. The second cause is ionizing radiation. They are produced by various sources. As an example, we have the atomic bomb dropped on Hiroshima and then another on Nagasaki, or nuclear accidents like that one occurred in Chernobyl, which bring them leukemia and breast cancer. The third cause is heredity. Inherited cancer genes are almost imminent factor in certain groups of families to develop the disease. However, there are cases in which the genes are only recessive and need other factors to manifest themselves. Then the fourth cause is sedentary lifestyle. Lack of necessary movement during the day can increase the risk of cancer. The defenses work better when you exercise and maintain the ideal weight. Alcohol contributes to the risk of getting cancer, and people who drink too much or abuse drugs are vulnerable to easily contracting malignant cancers. Then we talk about the pathophysiology of cancer. It is an alteration in cell differentiation which triggers an uncontrolled proliferation of a cell clone. The word cancer refers to neoplasms or malignant tumors. Some concepts associated with the cancer, for example, we have neoplasia. It is the process resulting from cancerous cell alteration. The word neoplasia means new growth. Then we have tumor. Initially, it was applied to the swelling, lump, or localized increase in size in an organ or tissue. It is currently used as synonym of neoplasia. Then we have oncology. Oncology is the part of a medicine that studies tumor or neoplasms, especially the malignant ones. Then we have the word metastasis. It is this continuous extension of a tumor to a territory more or less distant from the primary neoplasia. Cancer metastasis is the process in which cancer cells break away from the tumor where they originated and spread to other parts of the body through the bloodstream or lymphatic system. Metastasis indicates that the disease in the dismetated phase and it is difficult to eliminate the cancer. Specifically, most cancer emerge when cells acquire a series of mutations, for example, the DNA changes, that cause them to divide more rapidly, evade internal and external division controls, and prevent programmed cell death. Then we talk about the cancer epidemiology. Cancer worldwide is 43% of the global burden of disease by 2020, with 60% and 73% of deaths. Approximately 8.8 million cancer patients died in 2015. In the next 20 years, it is expected that there will be 3.2 million of deaths. In 2015, approximately 12,299 new cases of cancer, being the most common of cervix, breast, stomach, and prostate. Women between 30 to 79 years and men between 60 to 79 years are more frequently registered. Smoking is the main factor causing 71% of deaths from lung cancer.
Patients with cancer experience multiple symptoms, including dyspnea, fatigue, insomnia, loss of appetite, and cognitive impairment, anxiety, and depression. These symptoms deteriorate daily the quality of life of the patients. That doesn't get better with rest. Weight loss or gain of 10 pounds or more for no reason. Eating problems shows as not feeling hungry, trouble swallowing, belly pain, or nausea and vomiting. Swelling or lumps anywhere in the body. Pain with no reason that doesn't go away or gets worse. And skin changes. The tests used to detect cancer vary depending on the type of tumor that is suspected. For some types of cancer, studies show that screening tests can save lives by diagnosing cancer early. For other types of cancer, screening tests are recommended only for people at higher risk. In the physical exam, the doctor can feel areas of the body in search of lumps that may indicate cancer and can look for abnormalities. Laboratory tests such as urine and blood tests help identify abnormalities that may be caused by cancer. There are many types of treatment for cancer. The treatment the patient will receive depends on their type of cancer and how advanced it is. Some people with cancer will only receive one type of treatment. However, most people receive a combination of treatments, such as surgery with chemotherapy or radiation therapy. They may also receive immunotherapy, targeted therapy, or hormone therapy. Diagnosis must be diagnosed on time with the purpose of increasing life expectancy and quality to improve the response to cancer. It's crucial that patients have immediate and ongoing access to both diagnostic services and treatment.